Good evening, OSH professionals and those who aspire to be OSH professionals all around the world. Today, we're going to discuss what health and safety is. But before we start, I need to introduce my name. I'm Okuni Ivan Moses, Associate Safety Professional, certified by the Board of Certified Safety Professionals. That's United States of America. And then associate member of the Institution of Fire Engineers, UK. And I'm also an interim chartered fire engineer and a certified OSH trainer. What you can see again is the link to my YouTube account, where some of these videos will be uploaded. Housekeeping rules, please follow the videos, gain an understanding, and if you have questions, if you watch the video on Facebook, please put your questions on the comment section, then I'll be in position to answer. Also, if it's on YouTube, please put your questions on the comment section, and remember to be respectful with other people's opinion. So let's dive into what OSH is. So we'll start by defining what safety is. Safety means being free from harm. Harm can be anything that inflicts pain on you, or the absence of risk of serious personal injury. For example, walking under load suspended from a crane during a lifting operation is not safe. Why? This is because in case the ropes break, the load will definitely crush you, will fall on you. No matter what kind of PPE you're putting on, you'll be crushed. So, or sometimes it means staying out of danger. You're not going to go to an area where you're not authorized to go to. And then we continue with health. What is health? The absence of disease or ill health, or being free from diseases. So in a workplace, we have what we call occupational diseases. For example, occupational asthma, metal fume fever, asbestosis, and many other diseases that you can contract due to the nature of the work that you do. For those who are like building contractors who renovate buildings that have asbestos, are exposed to asbestos, and they will suffer from a disease called asbestosis or lung cancer. Those who work in steel manufacturing plants who are exposed to metal dust suffer from metal fume fever, and those also can suffer from occupational asthma. There are also other diseases that may affect you at work, but they are not necessarily because of the work that you do, but because of you being around people who are sick, and they are called communicable diseases. For example, flu. Yeah. Health relates not only to physical ill health, but also mental health. So sometimes you may realize that a person is physically okay, but mentally ill. So as a health and safety professional, you need to develop programs that help the employees to manage both their physical health and mental health. Some occupations are so stressing. Maybe someone has the highest load. You may not realize because someone looks big, they go to the gym, but when you assess their mental well-being, you realize that they are not doing well. And then we continue with occupation. What does it mean? It means it's related to the job or work or your profession. So occupational health and safety looks at how your occupation contributes to ill health or accidents or harm. So when you study occupational health and safety, you're going to look at how you can manage accidents, harm, both physical and mental, that arise due to the work that you're doing. So we shall continue with now the definitions. Welfare. This means access to basic facilities such as toilet facilities, hand wash stations, changing rooms, restrooms, and places where food can be prepared and eaten in relatively hygienic conditions. And drinking water and basic first aid. So that's what we call welfare. Hazard. Anything with the potential to cause harm. For example, walking on top of a trench that is being excavated means the soils are loose and unstable, so any simple mistake could make you fall into the trench and injure yourself. So a hazard is the trench, so something that exposes you to harm. So that can be material, equipment, environment, people, and systems. It's funny, sometimes people say even your workmates are hazards. And someone one time gave an example. If your workmate is mad or runs crazy and they start stoning you, and they're hazards, of course they're hazards. That's just a joke anyway. And then the risk is the likelihood that a hazard will cause harm. Okay, so that is it. The reasons for managing health and safety. Why do organizations want to manage health and safety? So there are three specific reasons. One of them is a moral reason. There are expectations from the community that the employer should maintain and promote good health and safety at the workplace to safeguard their employees from harm. And then legal reason. This is because every society, every country has set laws and regulations to govern occupational health and safety. So meaning there are requirements that organizations have to comply with. So the reason they promote health and safety is because they don't want to contravene with the laws of the countries where they are operating. And then economic reason. Here we see that accidents are costly. So when an accident happens, there are higher chances that you're going to lose property, you're going to lose lives. So there's going to be direct costs and indirect costs that are going to affect your operation. So definitely that's the reason why companies promote good health and safety. Just like from the previous slide, we already described what moral reason is. People being killed, sick, injured is not accepted or is unacceptable to the society. So the companies have to ensure that people are protected while they're at work. Legal reason, sometimes fines or even closures of these workplaces because of poor working conditions is to avoid that is a reason why these employers promote good health and safety. And then the economic reason, the direct costs and indirect costs. Really, they want to, most organizations exist because they are businesses, they are profit oriented. So anything that increases the cost is they pay attention to it to ensure that they mitigate any negative impacts. So examples of direct costs of an accident are fines in the criminal courts, first aid treatment, worker sick pay, repairs to replacement of damaged equipment and buildings, lost or damaged product. Examples of indirect costs: loss of staff from productive duties in order to investigate the incident, prepare reports, undertake hospital visits, deal with relatives, attend court proceedings, all those. Loss of staff morale, cost of recruiting and training new employees, or replacing the ones who have been hurt. And then general difficulties in recruiting and training staff. You know, people, if you have poor working conditions, people will fear to come and work with you. So that's the reason why employers actually promote good health and safety. Whose responsibility is health and safety? It is for everyone, the employer and the employee. So for Uganda, the Occupational Safety and Health Act number 9 of 2006 clearly stipulates the responsibilities of employers and the responsibilities of employees. So employers, they are to protect their workers, provide PPE, assess the risks and ensure they identify all the risks. All those roles, if you downloaded the OSH Act, you will be able to read them and understand. And then the roles of the employee are, take care of themselves and others who are working with them, reporting dangerous situations to immediate supervisors, right to move away from dangerous situations in case you realize that, like in some areas they say right to stop work if it endangers your health and safety. So sometimes workers are allowed to step aside and say, you know what, I will not do this work if this is not sorted. And also you have to comply with the law, because sometimes due to negligence, and you cause an accident because you're negligent, you can be prosecuted. So both employers and employees are bound by the OSH Act. It's not only that the employee is the one who is penalized or taken to courts of law. No, both the employers and the employees, anyone who contravenes the requirements of the Act. So now looking at the safety and health management system, these are the components of the safety and health management system. You need to have a policy. It's like it defines the direction of the organization, it defines responsibilities, it gives a mandate for a specific person appointed to implement the system. It also requires organizing both all the resources, financial and other resources like labor, training, and then planning and implementing. So once the policy has been set, a team has been also set up, well trained, and then the responsibilities have been assigned to each member of the team. Then they start now, they have to develop plans of how they're going to execute their responsibilities. So in the planning stage, they will be able to set key performance indicators, and this one should be smart, should be measurable. And then after that, they implement the system, and then at a certain time, they're in position to evaluate if the system is performing as intended. So that's where now they initiate audits. So they check the results vis-a-vis the key performance indicators. So those key performance indicators that have been met, those ones are ticked. So those ones that have not been met, they are reviewed, and then a corrective action plan is set, and then duties are assigned to each person, the timelines And then the health and safety specialist, or the person heading or managing the health and safety management system, initiates follow-up meetings to ensure that each action has been closed out, and then this within the specified time. And all these actions actually are set in terms of priorities. So those ones that need to be implemented immediately, those ones are given the first priority, as long as maybe if they are not fixed, they will lead to death or destruction of property. So those ones are looked upon, so the action may be immediate. And those ones also that may require a longer time to fix, possibly because they require a lot of money, or also technical input. So there is a cost benefit analysis when it comes to corrective actions. So we defined what a health and safety policy is a written statement by an employer stating the company's commitment for the protection of health and safety of the employees. This was already described in the previous page, but it's okay, you can read it. So that's the template, but it's not universal. It's just like what I'm using to explain to you how a health and safety policy looks like. So when you look at organizing, like I said, roles and responsibilities, who will do what, resource allocation, what do they need to do the job, lines of communications, how do we share information, and of course now appointment of staff, specialist staff in health and safety. And then planning and implementation. Detailed arrangements will be made for the management of health and safety risk assessments, identification and implementation of safe systems of work. For example, before, like every morning before employees start working, you conduct toolbox talks. In these toolbox talks, you're going to state we call it the method of work. You see, that's the method statement. You state the method, how the work is supposed to be done, and then you're also going to define the risks the employees will be exposed to, and then the mitigation measures. And then, of course, there also you need to state the training requirements. So only those who are certified to operate certain equipment or to perform certain tasks are the ones who are supposed to perform them. So all this is defined from the toolbox talks. Yeah. And then monitoring and evaluation, this is where now audits come in. You're going to look at the key performance indicators that were set, and then also you have to look at the results, and then see if you met the key performance indicators or not. If not, you have to develop a corrective action and preventive action plans, and then assign duties to respective persons, and then the timelines, and then follow up to ensure these actions are closed out. Sorry. So that is it. Of course, the audit, depending on what you're looking at, sometimes audits are conducted if there is a change in the process or introduction of new machines, or if there's an incident or a near miss. Sometimes these ones trigger audits, but the audit plan can be set to be maybe monthly. You can do audits monthly, maybe depending on how risky the operations are. But auditing can be scheduled twice a year or just once in a year. Yeah, something like that. So the audit helps you see if your system is performing as it's intended or not, and if there are any improvements to be made to the system so that it performs as intended. So that is it. So like I said from the initial slide, that if you have any questions, please post them on the comment section of the Facebook page or the YouTube. Thank you.